The COVID-19 pandemic has hit the United States incredibly hard this year. It should be no surprise that prison populations are also being hit hard. They are not only being hit hard, but they are in fact getting the worst of it. This video will address how and why COVID-19 is affecting prison populations, demonstrate what initiatives have been taken since the pandemic hit, and what needs to be done to protect prisoners against COVID-19. The rate of COVID-19 cases reported by state and federal prisons is nearly 7,000 cases per 100,000 people in prison. That is more than 4 times the rate of confirmed cases per 100,000 U.S. residents. Not only is the virus spreading more rapidly in prisons, but inmates are more susceptible to die from it. On average, the COVID-19 mortality rate within prisons is 61.8 deaths per 100,000 people in prison, twice as large as the general public mortality rate. But why is COVID-19 having such a big impact on those living in prisons? Prison conditions are places for viruses to spread more rapidly because of the close living quarters. Staff leaving and entering the facilities will also increase the chances of the virus being introduced. It is also very difficult to social distance inside prisons. According to the American Correctional Association, cells should have at least 25 feet of space per person. That's not taking account into beds, desks, and other furniture. That's a 5 by 5 foot space for each person, leaving almost no room for maintaining the recommended 6 feet of distance between people. There are also limited resources for prisoners to protect themselves. The CDC recommends alcohol-based sanitizer containing at least 60% alcohol for protection. However, alcohol-based hand sanitizer is often prohibited for inmates because it is considered contraband. 17 state correction departments, 6 of the 10 with the largest inmate populations, said they will still not allow alcohol sanitizers because of safety reasons. Mask wearing is still an issue within corrections. 30 states currently require correctional facility staff to wear masks, while 20 states and the District of Columbia do not. Just because states require staff to wear masks, it does not mean that the policy is adequately enforced. There have been reports made by incarcerated people that correctional staff have not been wearing masks appropriately. 15 states currently require incarcerated people to wear face masks, while 35 states in the District of Columbia do not. Oddly enough, Illinois is the only state that appears to require incarcerated people to wear masks, but does not require the staff to wear them. Many prisons and jails are taking action to limit the populations because it can help slow the spread. In Baltimore, prosecution of all drug possession and other minor crimes is being deferred. In San Francisco, the district attorney has ordered the release of all persons in pretrial detention. U.S. Attorney General Bill Barr instructed federal prisons to free some inmates to lessen the impact of the coronavirus pandemic. The instruction was focused on prisoners who are not considered dangerous and who may have underlying medical conditions that make them vulnerable to the virus. His instructions apply to 170,000 inmates in the U.S. federal prison system. Some prisons have suspended visitations from family and lawyers because they want to limit the virus being introduced. Some states are easing those restrictions. There are several things that need to be done to protect those in prisons. Many of these ideas are not new, but need to be enforced. First, the correctional facilities need to limit the number of inmates in prisons. A study was done among 13 county jails in Massachusetts. Those with greater reductions in prison populations from early April to early July also had lower rates of COVID-19 infections. More testing needs to be done for inmates and staff. Testing can help identify those who have the virus and have been in close contact. Therefore, we can isolate the spread. This will offer more protection for individuals inside. Prisons need to be more diligent with personal protective equipment. Masks have been shown to work, therefore inmates and staff need to wear them. I would suggest that states require prisons to have inmates and staff wear masks. Prisons should also revoke the rule of prohibiting alcohol-based hand sanitizers. During a pandemic, slowing the spread of the virus should be a priority, and hand sanitizers help protect individuals. There is evidence that prison populations are being hit harder than the rest of the U.S. because of close living areas, little protection, and older prison populations. To slow the spread, the United States has freed some individuals from prison and dropped small charges. There needs to be more done to protect individuals in prison. There needs to be more people released from prison, more testing, and allow prisoners to have more resources to protect themselves and others. In conclusion, we need to remind ourselves that inmates are people too. They deserve the same rights to health and safety as everyone else.